Hello, welcome to World of Microbes. This would be the last part of different blood types. Detailed videos on blood and its other types are already uploaded in our YouTube channel. The links of these videos are in the description. In today's video we will talk about platelets, also known as thrombocytes. What do they do? Where are platelets located? How many platelets are in my blood? What do platelets look like? What are the common conditions and disorders that affect platelets? What are common signs or symptoms of a condition affecting my platelets? What tests check the health of my platelets? What are common treatments for platelet-related conditions? How do I keep my platelets healthy? Platelets, also called thrombocytes, are tiny cell fragments in your blood that help with clotting. Platelets are your body's natural bandage to stop bleeding if you're injured. Tiny, colorless cell fragments in our blood that form clots and prevent bleeding. Produced in the bone marrow, they circulate through the bloodstream and are critical for wound healing, surviving surgeries, and managing traumatic injuries. Just a single drop of your blood contains tens of thousands of platelets. It's important that you have enough, but not too many of them. Too few platelets can put you at risk of losing too much blood if you're injured. Too many platelets may increase your risk of dangerous blood clots. The right number of platelets can prevent blood loss during injury without putting you at risk of harmful clots that can restrict blood flow. Your platelets' primary function is to stop bleeding if a blood vessel gets damaged. During an injury, platelets cluster together at the site of the wound to act as a plug. They also help seal the blood vessels in a process called clotting, coagulation, to prevent excess blood from leaving your body. The official process to stop bleeding from a damaged blood vessel is called hemostasis. Here's a breakdown of how platelets function during hemostasis. Adhesion: the platelets that circulate in your blood travel to the break in the blood vessel wall and adhere, there. Activation: the platelets that stick to the wall go through changes that keep hemostasis going. For example, they release substances that cause the blood vessel to narrow so less blood seeps out. They also release substances to attract more platelets to the wound site. They change shape so that it's easier for the new platelets to bind together. Aggregation: the platelets stick together to form a temporary plug that seals the break in the blood vessel wall. The action of the platelets triggers a series of events called the coagulation cascade. During this process, proteins called clotting factors work together to create a substance called fibrin. The fibrin acts as a powerful mesh that reinforces the platelet plug. Together, these elements form a more stable blood clot that stops the bleeding. Platelet formation, known as thrombopoiesis, is the biological process by which bone marrow stem cells produce blood platelets. During this biological journey, a single large precursor cell fragments to release thousands of tiny, anucleate, nucleus-free, platelets into the bloodstream. Here is the step-by-step breakdown of how platelets are formed. Stem cell commitment: the process begins with pluripotent hematopoietic stem cells located inside the bone marrow. Under the influence of chemical signals, these stem cells differentiate into common myeloid progenitor cells, which are destined to become myeloid blood cells, RBCS, certain WBCS, and platelets. Hormonal stimulation, TPO: the primary driver of platelet production is a glycoprotein hormone called thrombopoietin, TPO, which is constitutively produced by the liver and kidneys. TPO binds to specific receptors on the progenitor cells, signaling them to differentiate specifically down the platelet lineage. Megakaryocyte development and endomitosis: the committed progenitor cells transition into megakaryoplasts and eventually mature into megakaryocytes, which are massive cells distinctive to the bone marrow. Endomitosis: during maturation, megakaryocytes undergo a unique process called endomitosis. They replicate their DNA repeatedly without actually dividing their cytoplasm. Cellular expansion: as a result, the cells grow up to 10 to 15 times the size of standard blood cells and accumulate a massive reservoir of cytoplasm, proteins, and internal membrane structures called the demarcation membrane system. Proplatelet elongation: once fully mature, the megakaryocyte migrates close to the sinusoidal blood vessels, vascular niches, of the bone marrow. Driven by internal structural components, microtubules and actin filaments, the megakaryocyte pushes long, branching, ribbon-like cytoplasmic extensions called proplatelets directly through the blood vessel wall. Fragmentation and fission. As these proplatelet ribbons extend into the rapidly flowing bloodstream, the dynamic shear stress, flow forces, of the blood causes them to fragment. The proplatelets strip apart into smaller intermediate structures like preplatelets and barbell-shaped platelets. A final microtubule-driven fission event breaks these intermediates down into individual, mature, disc-shaped platelets. A single megakaryocyte can yield anywhere from 1,000 to 3,000 platelets before its leftover nucleus is safely consumed by bone marrow macrophages. Your platelets are located primarily in your bone marrow, blood, and spleen. Bone marrow. Platelets form from the largest cells in your bone marrow, white blood cells called megakaryocytes. New platelets bud from the megakaryocytes. This is why platelets are considered cell fragments instead of whole cells. Blood. Whole blood consists of plasma, the liquid part, red blood cells, white blood cells, and platelets. As platelets are the lightest component of whole blood, they are pushed to the walls of your blood vessels, allowing plasma and blood cells to flow through the center. The location helps platelets reach injured blood vessel walls quickly to stop bleeding. Spleen. Your spleen stores about 1/3 of your platelets. It also filters old or damaged platelets. Platelets and white blood cells make up 1% of your whole blood, along with plasma, 55% total volume, and red blood cells, 44% total volume. There's about 1 platelet for every 20 red blood cells in your body. A healthy adult generally has between 150,000 and 450,000 platelets per microliter of blood. Because platelets only live for about 7 to 10 days, your bone marrow is constantly producing new ones to maintain this balance and help your body properly clot blood and prevent excessive bleeding. Your exact platelet count cannot be determined without a specific lab test. The only way to know your exact number is to check the results of a routine blood test called a complete blood count, CBC. If you recently had a CBC test, you can find the platelet count listed on the lab report under the PLT force platelet section. Here is how your results are generally classified. Normal, 150,000 to 450,000 per microliter. Low, thrombocytopenia less than 150,000 per microliter, can cause easy bruising or bleeding issues. High, thrombocytosis greater than 450,000 per microliter, can increase the risk of unwanted blood clots. Platelets are tiny, colorless cell fragments in the blood that are about 2 to 3 micrometers in diameter. They lack a nucleus and change their shape depending on whether they are resting or actively working to stop bleeding. Resting state, circulating through the blood, they appear as small, flat, colorless discs or ovals, somewhat like a tiny convex lens. Activated state, when a blood vessel is damaged, platelets are activated. They grow long, sticky tentacles and can resemble a tiny spider or octopus. This helps them interlock with other platelets and seal the damaged area. Under a microscope, they appear much smaller than red or white blood cells and are often stained blue or purple to make them visible against other blood components. Platelet disorders are conditions where blood platelets either do not function properly, are too low in number, or are excessively high. Common symptoms include easy bruising, frequent nosebleeds, and prolonged bleeding from cuts. These are categorized into 3 main types. 1. Low platelet count, thrombocytopenia. This condition occurs when there are fewer platelets than normal, making it difficult for the blood to clot. Immune thrombocytopenia, ITP, an autoimmune disorder where the immune system mistakenly attacks and destroys healthy platelets. Thrombotic thrombocytopenic purpura, TTP, a rare disorder that causes small blood clots to form in blood vessels throughout the body, consuming platelets in the process. Medication-induced thrombocytopenia, certain drugs, like some antibiotics, seizure medicines, or blood thinners, can cause a drop in platelet counts. 2. High platelet count, thrombocytosis thrombocythemia, an abnormal excess of platelets can cause blood to clot unnecessarily or inappropriately. Essential thrombocythemia, ET, a rare bone marrow disorder where the body produces too many platelets for no apparent reason. Reactive thrombocytosis, temporary or chronic overproduction of platelets caused by another underlying health issue, such as severe infections, chronic inflammation, or iron deficiency. 3. Platelet dysfunction. In these conditions, the platelet count is normal, but the platelets do not stick together or function as they should to form a proper clot. Von Willebrand disease, VWD, the most common inherited bleeding disorder, which affects the protein, von Willebrand factor, that helps platelets plug damaged blood vessels. Glanzmann thrombasthenia, a rare inherited condition where platelets lack a critical protein needed to stick together and form a plug. Bernard-Solier syndrome, an inherited disorder where platelets are unusually large and lack the proteins needed to adhere to the walls of damaged blood vessels. Drug-induced dysfunction, common over-the-counter and prescription medications, like aspirin, NSAIDs, or SSI antidepressants, can actively inhibit platelet function. We will discuss these conditions in details in separate videos in the future. Common signs and symptoms of platelet conditions include bruising, including purpura and petechiae, frequent nosebleeds, epistaxis, or bleeding gums in your mouth, blood in your poop or pee, internal bleeding, excessive bleeding from small wounds, heavy menstrual bleeding, menorrhagia, an enlarged spleen, splenomegaly, muscle and joint pain, tingling in hands, feet, paresthesia, leg swelling, edema, severe headaches, weakness or dizziness. Tests that check the health of your platelets include complete blood count, CBC. This blood test identifies how many blood cells and platelets are circulating throughout your body. A platelet count is the specific part of a CBC that checks how many platelets you have. Peripheral blood smear, PBS. During this test, a provider looks at a sample of blood beneath a microscope to check for abnormal blood cells and platelets. Oddly shaped or giant platelets may be signs of a condition. Blood clotting tests, a prothrombin time test and a partial thromboplastin time test check for multiple factors related to how your blood clots. Bone marrow biopsy. Your healthcare provider removes a sample of your bone marrow to examine the health of your cells where platelets form. Genetic tests. These tests can show if you have a genetic mutation, a change, that's causing issues with how your platelets function. Treatments for platelet conditions include over-the-counter medications. Taking a low dose of aspirin daily can prevent harmful blood clots if you're at risk. Prescription medications. Some medications slow the production of platelets in your bone marrow. Others treat the condition causing abnormal platelets, like autoimmune diseases or infections. Plateletpheresis. This procedure is a type of apheresis that treats high platelets. It uses a machine to filter out some of the excess platelets. Platelet transfusions. You may need a special type of blood transfusion that involves receiving blood with high concentrations of platelets if you're at risk of severe blood loss because of low platelets. Surgery to remove your spleen, splenectomy. You may need this surgery if your spleen is trapping too many platelets and causing low counts. Disclaimer: the treatments and information provided are for study and educational purposes only. This is not a substitute for professional medical advice. Please consult a qualified doctor or healthcare provider immediately if you are experiencing any symptoms or have health concerns. It's important to follow your healthcare provider's instructions if you have a condition that's causing problems with your platelets. Even if you don't have a condition, you can care for your platelets by limiting your alcohol intake, not smoking, avoiding toxic chemicals, taking care to avoid injury. You can also help care for others by donating platelets. The process is similar to donating blood, except it involves removing some of your platelets and returning the other blood components back to you. Platelet donations help individuals with chronic illnesses, cancer, or serious injuries.